The broadcast is now starting. All attendees are in listen-only mode.
Well, good morning, everyone, and welcome to today's webinar on workers' compensation claims. My name is Cole Cummins, and I'm the Loss Control Manager here at Alaska Public Entity Insurance. And before we get started, and just like we do with each webinar, as we go over the GoToWebinar controls, make sure everyone's familiar with them and how to work them throughout the presentation. It's pretty simple. You'll see a control panel with the little orange arrow on there. You click on that orange arrow. As an attendee, you don't get many options, but you do get the option to type in some questions there. So if you can think of a question during the presentation, or even afterwards, we'll have a question and answer time, go ahead and type those in, and then me and Jessica will try to do our best to get as many answered as we can. This is generally a topic that we get a lot of questions for. So if we don't get through all of them today, we do have everyone's email and phone number who signed up for the webinar. So if we don't get to your question today, we will give you a call back or an email back and get that answered for you. Okay, so let's go ahead and get started. Today we are talking about workers' compensation, and we like to do this one on an annual basis for a couple reasons. The first one we like to give it is because Alaska, as you know, has high workers' compensation premiums, which I'm happy to report went down this year because of APEI's members, which is you guys, and your great loss experience. I was just looking at our overall claims history, and the loss frequencies, so how often the claims happen, have been dropping over the last few years, which is great news. And what it does is it shows how committed folks like you are in your efforts to reduce injuries and to help keep your workplaces safe. So that's great news, and I appreciate that. Thank you. The big problem that we run into is the cost of medical services here in Alaska, and we all know that they are very high. And recently, this morning actually, I looked at a report from NCCI, which is the National Council on Compensation Insurance, and let me read you the numbers here. They said that the report showed that the medical costs were 72.9% of a time loss claim, so the remaining 28% was the indemnity cost. So 72% was medical compared to 58%, which is the nationwide average. So that's quite a big jump. That's almost, well, let's see here, 15% higher than the rest of the world, or not world, rather the country. So the medical costs in Alaska are high, but because we had such good claims history, that's why the workers' compensation premiums went down this year, because of the claims history that outperformed that increase in medical costs that we're seeing, which is great news. So that's the first reason for the webinar, is the cost. The second is because our claim staff here, our workers' compensation claim staff, they get a few questions throughout the year on issues, forms, how do you fill it out, things like that. So hopefully by the end of this webinar, you'll be an expert, or at least you'll be knowledgeable in Alaska's workers' compensation process and what we need from APEI from you guys to get your employees set up with their claims. So our presenters today will be Jessica Garrett. She is our workers' compensation claims manager, and she's been helping me do this webinar for the last probably 4 or 5 years now. And she is your go-to person for claims questions. She's the most knowledgeable in our office. And throughout the presentation, you'll also hear us talk about Buffy Blaze, who is our claims examiner, and she handles the medical-only claims. And then also Chris Luck, who is our office manager, also assists in the claims department as well. So you'll hear those names a couple times. But Jessica is our main contact for time loss claims, and also for any major issues that you run across in the claims arena. And then I'll be also helping in the presentation today, talking more along the lines of how to reduce costs and how management can help in the claims process and what we can do after an injury happens and things like that. So Jessica will be going over the workers' compensation claims process, and I'll be kind of talking about what management can do to assist in that process and also to help get the employee back on the job and to reduce costs. Our topics today, we're going to talk about management's role and responsibility. Like I just said, how we can get management involved to assist with our mid-level supervisors as well as our employees who are the injured ones, and how we can get them back quicker, healthier, faster, and less expensive. We'll talk about common issues that employers face in the workers' compensation field, as well as just common injuries. Jessica will go over the claims procedures and how that whole process looks. We'll talk about working with the adjuster and which adjuster you use for which type of claim and what they need from you and how you can make their life easier, but also hopefully, like I said, by the end of today, you'll be able to, we'll be able to hopefully make your life a lot easier as well, just by giving you a better understanding of how the process works. I'll touch on return to work programs and how beneficial they are, not only to the employer, which is you, but also the injured employee and getting them back on the job, and how beneficial that is for them. And I'm seeing here we have someone that doesn't have the slides or the presentation hasn't started yet for them. And I was wondering if anyone else had that issue. Okay, never mind. We are good now, and she's good to go. Okay, so return to work, I'll touch on that. Also, preventing future losses and how we can take the losses that we've had in the past and how we can look at those numbers, look at those trends, and then make it a safer workplace and how we can keep those from happening in the future. And then I'll also touch on record keeping and what some of the OSHA requirements are for that, for reporting injuries and things like that. So that's kind of our agenda for today. First off, we'll start with management's responsibilities, and this is really important. I think that for each employer, you should have a written standard for timely reporting of claims. So when you have a section in your handbook or whatever you have on injuries, workers' compensation, all that kind of stuff, you need to make sure you put in there timely reporting. We'll talk about it here in a couple slides, the effect of timely reporting and how costly it can be if you don't report on timely there. Training for all supervisors and employees, and this is a big one as well, because for employees, and for most of us, we'll live our lives without ever having a workers' compensation claim, and that's a good thing. But some folks, they get injured or they get hurt, and there's a stigma towards workers' comp that it's maybe embarrassing to file a claim and show that we got injured and things like that. So we want to have training for all our employees and say, you know what, it's okay. We want to know about it. Matter of fact, it would be really helpful for us if you told us that you got hurt, or even if you just fell down and got a bruise or something. That kind of information is helpful to us so we can prevent a future injury. Return to work program is also a management responsibility, and we'll talk about how to create that program as well as some of the benefits of it here at the end of the presentation. Forms and contact information. Management needs to have this stuff available to staff. And this is the forms I'm talking about specifically here is the 6101, or that report of injury form that is what you fill out to send in to us here at APEI. So after an employee gets injured, he or she has to fill out their section of the 6101, the employee section, and then also the employer has to fill it out. So make sure that you have training on those forms, and make sure that your staff is knowledgeable on how to assist with their employees in this process. It doesn't have to be a big training. They can just show it to them and then kind of walk them through it after they have the injury. And just don't throw them out on an island to do it themselves. Make sure you help them out and walk with them. It doesn't have to be the HR person or whoever's in charge of workers' comp. It should be the supervisor as well that assists in this process. And then management's responsibility is also to have the mandated posters posted throughout the workplace. Things like FMLA, wage and hour, OSHA's poster. We're also required to have the workers' compensation poster as well that shows who our workers' compensation coverage is through. And the main thing I want to point out with this is it can't just be at City Hall or the school business office. It has to be at each workplace, each facility. So if that's the maintenance building down the street, and there's employees that go there to do their work, or that's where their offices are, they need to have the posters there as well. A lot of schools and cities I go to, I see these really fancy, big posters that have all the information. Those are great. I just want to make sure that everyone's aware that it's not required to have them in that kind of format. You can go to the State of Alaska's website and print them out for free. Matter of fact, I did a newsletter a couple years ago on which posters you're required to post in your workplace. So give me a call or shoot me an email or just go onto our website and take a look at that newsletter article. It's pretty helpful. One thing I'm seeing a lot of now is a lot of people calling and emailing our APEI's members as salespeople and saying, hey, you need to have these posters. If you don't do it, you're going to get fined from OSHA and all this kind of stuff. We have the product right now. It'll only cost, I don't know, a couple $100 or whatever it is. Don't fall for those scams. If you get those calls or emails, give me a shout. There are requirements to have these posters, but not through these salespeople. Like I said, there's cheaper ways to get around it. You can print them off right off the state's website. So, but just make sure that you have these posters in place so employees, and I guess especially we're talking about workers' comp today, so employees know it has the contact information, who the carrier is, and things like that, and just make it visible for your employees to see. I briefly want to talk about the employer's liability for compensation, and I touched on this briefly last year, and I just want to bring it back up. I'm sure most of you guys are familiar with this, but if there's someone out there that's not, or if I can help bring some clarity to this, I think it's important. And we're looking at Alaska Statute 23.30.045, specifically in Section D. And the main part I want to discuss is the need to verify or obtain proof of coverage for a contractor before you award them the contract. If you look at the top here, it says a contract may not be awarded to the state or other political subdivision of the state, which is what we are as public entities. So schools and cities are political subdivisions of the state. You have to obtain that current coverage of their workers' compensation insurance. Because if you don't, if you read down here at the bottom, it says if the state or the political subdivision of the state fails to obtain proof of coverage or self-insurance or to protect itself under E of this section, and an employee of the contractor is injured, so you have a construction company come, or you have someone else that's doing maybe a contracted janitorial work, and they come in and get injured during the term of the contract, the state or the political subdivision, like I said, which is us, is liable for workers' compensation to that employee if the employee is unable to recover from their contractor or their employer's coverage because they didn't have it or they have lack of financial assets. So if you don't verify that they have coverage, workers' compensation coverage, and you award them the contract, they get hurt and their employer doesn't have the financial assets or the coverage to provide them with workers' compensation benefits, it could fall on you. So I want to make sure everyone's aware of this, and it's pretty slick. I have a workers' compensation coverage verification tool here. It's real simple. You just go to the state's Division of Workers' Compensation. You click on Employers' Workers' Compensation Coverage. You make sure that you're not a robot, you accept that, and then let's go here. Let's just pick an example. Okay, July 1, and this morning I typed in the city of Unalaska just for fun, so we'll look them up, and here it is right here, city of Unalaska. You click on them, insurance coverage provider, Alaska Public Entity Insurance for workers' comp. The coverage date was from 7/1 of 2018, so you know that the city of Unalaska has their workers' compensation coverage, and you can do this for anyone. And you need to be doing this for everyone, especially those contractors that come to do work for your school district or for your municipality. And it's real simple to do that. Okay, let's see here. I want to talk briefly about the post-hire questionnaire. We've done this every year for the past, I don't know, 10 years, talking about the post-hire questionnaire and how beneficial it is. I want to go over it briefly, and then I want to talk about some changes that are coming up. So it says, under Alaska law, we can get reimbursement from the state secondary injury fund, or that SIF, which most of you are familiar with, for payments made to certain injured employees. And here's kind of what the state, I took this next bullet right from the state. It says, to receive reimbursement, the employer must demonstrate that the employee had a qualifying pre-existing condition, the employee was hired or retained with full knowledge of this condition, and then a subsequent injury, when combined with the pre-existing condition, resulted in a condition substantially greater than the subsequent injury alone. It's a mouthful there. And it also has to go up to 104 weeks of compensation payments for that employee. So it's 2 years. So it's a pretty good amount of time. So basically what it is you have this post-hire questionnaire form here. You have your employees fill it out after you hire them. So it's post-hire, remember. And then you can, if you like, do it on an annual basis. We always recommend that to make sure that we didn't miss anything. And then if you have the information from this form, and then the employer gets hurt or gets injured in some other fashion combined with that pre-existing condition, APEI will pay up to the 2 years or the 104 weeks, and then the state, that secondary injury fund, will kick in after that 104 weeks. So it saves APEI money, which in fact then saves all our members money because we don't have to pay that, and the state picks up the tab. Now, I just want to let you know that the secondary injury fund is going away. And this is brand new. This just passed recently. And you can read this here, section Alaska Statute 233205. But mostly I just want to show you the bolded and the underlined section here where it says, a claim for reimbursement may not be submitted for an injury or death that occurs after August 31st, 2018, and must be submitted before October 2020. So what it's saying is that after August 31st, if there was an injury or something that happened after August 31st, it no longer qualifies for the secondary injury fund. But if it happened before August 31st, we have up to October of 2020 to report it. So I still think for the next month, if you hire someone on, I think it's a beneficial form to have them fill out, because we still have a month that we could benefit from that. But after August 31st, you don't have to fill that. I mean, it's never been a required form, but you don't have to fill that form out, and we wouldn't. You would not qualify for the secondary injury fund after that. So that's a little piece of new news there. Many of APEI's claimants never, I mean, most of them never reach that 104-week threshold anyway, so the 2 years. So we don't see many of our members that utilize the secondary injury fund, thankfully. But there have been a few, and it has saved APEI quite a bit of money from the secondary injury fund paying into that. So anyway, just something to keep your eyes on. And then real quick, I'll talk about claims reporting. Jessica is going to talk about the whole claims process here shortly, but I just wanted to talk about claims reporting and the importance of filing a claim in a timely manner. And Jessica will talk about timely manner a couple times too. But my next slide after this one is going to talk about cost and heartache if the claim wasn't reported on time or within a timely manner. So timeliness is critical to the claims process. The next one, it says, it's important to allow the adjuster to make timely claims determinations and payments. If we hear about an injury and they file the claim immediately, Jessica and Buffy, they have plenty of options. They can say, okay, let's try this or let's try that, and we can go here and we can get this one taken care of quickly. But if we don't know about it for a week or even a month, and then once we finally get to it, once it's finally presented to us, our options are limited after that. So, and then the payments can't be made out quickly like they would have if we would have got the claim filed immediately. And Jessica will talk more about that as well. I just want to briefly say how important claims reporting on time is. It says here results in faster resolution of a claim, and that's something Jessica will talk about. Mandated by OSHA to report within 8 hours, and this is fairly new within the last couple of years. The federal OSHA, and you probably already know this, changed theirs from, so it says 8 hours if it involves a fatality, loss of an eye, or overnight hospitalization or amputation of a body part. And federal OSHA said 8 hours for a fatality, but 24 hours for the rest. And Alaska OSHA has the ability to be more strict. They said, no, we want to make it 8 hours for everything. So if there's a fatality, loss of an eye, inpatient hospitalization, or an overnight, or an amputation of a body part, we want to know within 8 hours. And this is, it can be difficult. We had a member that had a fatality, and they thought that they made all the right calls. They called APEI, they called everyone else, and they forgot to call OSHA. And so they jumped on them real quick for failure to report. So it's something that should be in the claims process. Those written procedures I talked about earlier, that should also be something in there that we remember to do, is call OSHA. You definitely want to call APEI so we can get the ball rolling on our end, but OSHA requires that confirmation within 8 hours. And that's, they have overnight calls as well. You know, they have weekend stuff. So if it happens, say on a Friday night, and you think it's 10 o'clock, it's too late, or maybe it's 6 o'clock, whatever, OSHA requires that it's still within that 8 hours. Now it gets difficult when it happens and the employee doesn't tell, you know, their supervisor, not obviously not a fatality, but you know, maybe a amputation or an overnight hospitalization. So it gets challenging when they don't tell you, which is why we talked about earlier in the training of your employees about this whole process. We need to make sure we remind everyone that when you do get injured, call me immediately. You know, we have, even here at APEI, we have a after hours contact number, and I'm sure all you guys do as well. And so make sure that your staff is aware of that. And Jessica will talk about possible fines if you fail to report in a timely manner, and those prices can add up. Here's that slide I was talking about, the cost of delayed reporting. This is a study from 2015 that was done by the NCCI, which, like I said, was the National Council on Compensation Insurance. And the numbers are a little bit older. I was trying to find a new study with no success, but read these real quick and you'll see it's kind of a big deal to report on time. The first bullet, it says loss costs for claims reported within 1 week are 8% higher than those reported on the day of the incident. So just within a week, we're already going up 8%. The next one, it says loss costs for claims reported after 1 month are 37% higher than those reported on the day of the incident, which is huge. Remember I talked about earlier, you file right away. Jessica has the ability to, you know, maybe send you to someone that's can get it taken care of, you know, quickly, or can diagnose it, you know, faster and things like that. But if you wait a month, we're already behind and the injury's already worse, and so we have to do the more expensive route now, and the more invasive perhaps. So 37% after a month. And the last one, it says claims reported after 1 month are 3 times more likely to be litigated than claims reported on the day of the incident. And that's a huge number. 3 times more likely to be litigated. We don't see very many claims that are litigated here at APEI, mostly because Jessica and Buffy do a phenomenal job of working with our members, working with your staff to get you know, the results quickly. But there are some occasions where where there's litigated claims, and so we work at that, and it's expensive. And so that's why reporting your claims on time is really important, so we can make that injured employee happy, we can get them back on the job, we can get them their workers' compensation payments, and we can satisfy all those needs so they don't get upset, so they don't contact attorneys because they're upset with the way the claim is being handled. So just by reporting in a timely manner, we can really save us a lot of money. And then I'll let Jessica talk here about the claims process.
Okay, excuse me. Hey everyone. So we're going to start off talking about time loss claims. And time loss claims have initial 3-point contact with the investigation process, and that's not the done deal of the investigation process. It can go much farther than just the 3 people that are listed here on this, and it can take 24 hours to several weeks, and unfortunately we've got one still ongoing right now that's going to be approaching on, I think, over a month, and it's just due to the lack of information and the resources that we need to be able to finalize our investigation and figure out what is what. But anyways, with time loss claims, the initial 3-point contact begins with our employer, and this is extremely important that we have good contact with the employer, whether it be phone, email, or vice versa, whatever you prefer as a means of contact with you. Please let us know here at API. That way we can use that form of contact with you in order to get every question answered that we need as soon as possible. We will also, if possible, if the claimant, if we're able to speak with the claimant, we will reach out to them and interview them, find out kind of like, hey, can you give us a background of, well, what happened during this, and who they might be seeing as a physician, and what they so far know as the outcome, or what further treatment plan they're aware of at that point in time. We will also reach out to the physician. This is not always an easy process. Physicians, as you know, are very busy and can be really hard to get a hold of. Excuse me, and we will request medical records, we'll request a treatment plan, we'll request even prior injury information if there is prior injury to that specific body part. So yeah, that's our initial 3-point contact, sorry. So important points for time loss claims, forms. The initial 6101 with the employee and the employer forms, those can be tedious, it seems like, and sometimes the questions that we might ask as follow-up questions could feel like they're repetitive questions, but we're doing that as part of the investigation process. So for one, we need the forms filled out as thoroughly as possible and as legible as possible. We need them received to us as soon as possible, and we need all forms of contact information. We need that for the employer, we need that for the employee. So again, email, phone, whatever is easiest to reach that person, as well as that particular individual's supervisor, or if there are any witnesses to the incident. It's really important that we have contact information for those witnesses, especially if it's a severe injury. A minor paper cut, we don't necessarily need that contact information for witnesses, but something like, they're going to need multiple stitches or something is broken, we definitely want to be able to reach out to any witnesses over the age of 18, especially if it happens on the grounds of school and there's a bunch of students that witness it, that we understand that that's not something that we can really discuss with the students. Okay, and I kind of touched on this, but basically, if we realize that, hey, this person's had an injury to this same body part in the past, or during our investigation process, they tell us, yeah, I was in a car accident 10 years ago, then we are entitled to go back 2 years prior to the earliest known injury to that particular body part. So let's take that car accident, for example, and let's say it happened 10 years ago. Well, we can go back 12 years from the date of this particular injury that they're treating for currently and get any medical records related to that specific body part. Now, it does not mean that we can go back and get medical records for the whole entire body. Some people are really leery about that. Our medical records request is very specific, that we have the injured worker sign, and it says, we need medical records from this date, which is the date of injury, back to this date, whatever that prior injury date is, or whether it's just a simple 2 years from the date of injury back then. And we will list the specific body part or body parts if there's multiple body parts injured. That way, we're not getting medical information on something that's not related to the injury. We will also make a determination as to whether or not a nurse case manager needs to be assigned to the case. This is pretty critical, and luckily we hardly ever have to use this option, but this would be something like basically anything that's reported to OSHA within the 8-hour period, a loss of a limb and hospitalization. We know, fatality, somebody's going to be out for a while. That's when we usually want to get a nurse case manager involved, because they're kind of a point of contact. They can go directly to the hospital if the person's being treated in intensive care, and they have the resources to be able to speak with the physicians on staff at the time versus having to wait on the physicians to get back in touch with us like we do, when we're sitting here at the office. They also have the ability to be able to write up a case profile of what they have seen as a result of the injury. So basically what's gone on from this point to this point and what they're noticing could be the need for follow-up care, or what might not be necessary, or what seems kind of extreme as far as, treatment for this or treatment for that. So they can just kind of give a professional opinion for those extreme cases, and they can be really beneficial in a claim. But luckily, like I said, we, knock on wood, very rarely have the need to pull a nurse case manager aside and assign them to the claim file. All right, so sticking with time loss claims, disability slips and medical notes are extremely important. So you as the employer, if you receive any medical notes or any disability slips, which include, hey, this person, can only work with these restrictions, say they can only lift 10 pounds for 4 hours a day versus, 8 hours a day like their regular work schedule, we need all of those documents that you receive. And this will help us determine whether or not we need to be paying any time loss benefits, or whether any benefits at all throughout the life of the claim need to be controverted, or we need to watch carefully for what we are and aren't paying. And I bring that up because there are some times where people have injuries, say 2 days earlier, but it's not related to the actual work injury, and they might be going to the same physician to treat for both injuries. So we need to be able to see those medical notes that says, hey, they're treating for this and this, but this is separate from this. And you as the employer need to know that too, because if they're getting work restrictions for this incident that happened 2 days earlier, that's not going to be related to our work comp injury, and the benefits are going to be completely separate and completely different. So that's just a really important key line of communication between the adjuster and the employer, as well as the injured worker. That way we can, So again, timely contact. We will request wage information from you when there is lost time, basically anything more than 3 days of work. And it does not have to be 3 consecutive days of work necessarily, but there is no one-size-fits-all for a claim. So if you have questions on, hey, I think this person's missed 3 days, or we're cutting it close, or wait, they missed a day over here and a day over here, feel free to give myself or Buffy a call, and we can kind of help you pinpoint what really is and is not going to be considered 3 days for each individual claim. And if the disability slips that you receive, or even the injured worker has, are not received to API within 21 days of us knowing that there's going to be any time loss, that means that we will be controverting any time loss benefits. So time loss benefits meaning compensation for lost wages during the time that they are off as a result of the work injury. Okay, medical only claims. Those are separate from time loss claims, and I think the name kind of says it all. Basically, it's the injured worker, they get hurt at work and they're going to go to the doctor for, a one-time thing, or whether it's going to be, follow-up care for the next 6 months for physical therapy or chiro or something. Basically, it's just medical treatment without missing any time from work. And when I say without missing any time from work, that does not mean appointments. So if they've got an appointment, 3 times a week for an hour a day, that's not going to be calculated into their 3 days of missed work in order to receive compensation benefits. Getting those reports of injuries to us is extremely important. You can email me or Buffy, and our emails are listed there. A fax number is also available, and so those are the immediate ways to get to us. The fax comes directly to me via email, so I will get either form or either way, and then we will address the claim as soon as it is received. The the examiner who sets up the medical only claims is only going to be doing a 2-point contact. So that's basically they're going to contact the employer and the employee within 24 hours or 1 business day of receiving the completed forms. And they'll conduct their investigation process. Again, this can be an easy thing, and this can sometimes take, a couple days or a couple weeks. Most of the time, it's just a pretty easy thing where we get a hold of the employee and the employer, and we conduct our investigation and note our file. We send out a medical release, and if we see a need to request past medical records, we will do so. That's not always done on every medical only claim, though. Okay, and I think we're passing it on to Cole.
All righty. Well, thanks, Jessica. So that's kind of the claims process here, and you kind of get an idea of what Buffy and Jessica do on our end. Buffy just doing the medical only ones, so the ones that don't have that time off of work. Once they reach that stage, Buffy then passes them on to Jessica, and she becomes the main adjuster for that claim. And so there's a lot that goes into it on our end as well, which is why it's helpful if you guys understand the process, and then you can then forward it on or train your staff on, hey, this is the 6101 or that report of injury form, and we need this filled out, and then we'll fill out our employer form. We'll provide them to the adjuster, and then that, the sooner we get that done, the sooner we can get this thing rolling, and we can get you some of your benefits coming in. So I guess the main thing for me is just to remind staff and other employees that workers' compensation is not a bad thing. You're not in trouble if you get an injury and you're on workers' compensation. That's not the point of it. And then also the point is that they need to know how to do it. So if you have any questions on that, send them to Buffy or Jessica, and they'll walk you right through that 6101 form. They do it often. It's pretty simple now. It's all that fillable PDF stuff, so you can't mess it up too bad. Used to be, you had to fill it in, and well, I guess still people don't fill out the form completely, but it's now fillable, so it makes life a lot easier for us on our end, and also it allows you to know that you're taking all the steps there. Okay, so now let's talk about return to work programs, and Jessica talked about the claim stuff and the injured employees, and there's really not much an employer can do for their injured employee other than contacting them, which is a huge thing. Every time I go out to a member, I try to impress on them, hey, when you have someone that gets injured and they're at home on time loss, it doesn't hurt to call in and check in. And it doesn't have to be just the supervisor. It could be the city manager or the business manager or even the school superintendent, just calling in, hey, Cole, how you doing? I hope you're feeling better. We miss you here. Things aren't the same without you. Whatever it is, to kind of remind them that we're thinking about you and we want you back as soon as possible. Okay, so like I said, there's not much you can do for that injured employee. There's not much better you can do than a return to work program. And some folks call it a transitional work or even light duty. And kind of what the program is, it's temporary work, and remember, temporary is the key word, and temporary work that can be performed by the employee until they reach their full recovery. And that full recovery determination comes from their physician, and they'll let you know when they can sign off on the employee is back to their maximum medical improvement, and they're back to normal, and they can get back to their normal duties. And kind of how it works is that if you have an injured employee that the physician says, okay, well, he can't do his or she can't do her normal activities, like Jessica said earlier, she can't lift the 30-pound boxes she normally does, but she can lift 10-pound boxes, or she can do some other activities, and you have some work available for people. What you would do is you will be asked to write a letter stating the job task, the requirements of that job, the hourly pay that you're going to provide, and the date that the work is available, and you send that to the doctor for approval and also to the employee, letting them know that the work is available, and then hopefully they'll want to come back and do that work for it's a higher pay. So when you go out on workers' compensation, you don't get paid as much as you do when you're working your normal wage, your normal hours. So if you do this return to work program and your employer says, okay, this is what we're going to pay you, we're not going to pay you your full amount because you're still on this temporary thing and you're not doing your normal duties, or maybe you do pay them their full amount. It's up to you. But it's incentive for the worker to come back on the job. And here's a big one here. It says if the doctor approves and the employee refuses, we as APEI or the adjuster can controvert those benefits. So if the doctor says they are able and they're healthy enough to come back to work and do these jobs that you've listed on that letter that you sent, and the worker says, no, I'm not going to go back and do that, but the physician said they could, then we can controvert those benefits, because we don't want our employees to be out longer. And most don't do it. Most want to get back on the job, but there are some that abuse the workers' compensation system, and we just want to make sure that that's not happening. We want to get them back on the job, so we're not having to pay those costs. And then you're not having, as the employer, to hire someone else or to have overtime and other things like that to fill this employee's position. So we want to get them back on the job as soon as possible. Some of the examples for transitional work or light duty stuff, the real simple examples are answering the phones. If they're a police officer and they don't really know what they can do, maybe they can answer some phones. So they can maybe assist. They probably can't do the 911 operator's job, but maybe they can assist at the police station and things like that. Or if it's in a school setting, OSHA requires every year that we take a chemical inventory of all our chemicals. So if you're in a school, or if you're in the municipality as well, you can go around and you can take an inventory of all the chemicals that you have. A great place to start is in the science lab, science classroom. You can go in the janitor's closet as well. You can go in there, write down all the chemicals you have, make sure you have those safety data sheets for them. And if you don't, then that employee can get on the computer and print those guys out. So there's another option. One of my favorites is just housekeeping. Often I go out to certain members and they're just, cleanliness is an issue sometimes. And because we just either don't have time or we forget to clean up after ourselves after we do a job, or our maintenance shop doesn't have, isn't really tidy at all, tools are everywhere. That could be a perfect opportunity for someone in this transitional work program. They could come in and provide some of those services that get overlooked often. And I'm not saying that you make them lift the heavy tools. If the doctor says they can only lift 10 pounds, just allow them to help tidy up some of the smaller tools. And maybe they don't really like housekeeping, which is an even better incentive to get them back on the job to get back to their normal duties that they have, which they enjoy more. Of course, that's after the doctor approves that they come back to their full duties. It says return to work programs are one of the most effective ways to reduce the employer cost. And we kind of talked about that a little bit. When an employee's out, not only do you have workers' compensation payments that are going to them, which could potentially increase the premiums if there's lots of that, but you also have to account for that staff member being gone. So you have to fill that position or have someone else assist with that, and that could be overtime payments and things like that. But most important in return to work programs is getting that employee back in the job, back in the work environment. When people are at home sitting on the couch watching, daytime soap operas and things like that, they kind of lose touch of what's going on in the office world, and we like that. We like to go to work for that camaraderie as well as that social interaction. So people like that. So when you get them back on the job sooner, they feel like they're still part of the team, like they know what's going on, and it helps them get back on the job faster. Lots of studies out there and lots of good online programs to help you get return to work programs going. Also, the APEI Loss Control Manual, which I will be sending out an updated version of it here shortly. I've almost completed the updates for this for this new policy year. It has a complete section just dedicated to a return to work program and kind of the process on how to establish it and how to run it as well. So I would check that out if you haven't yet, the Loss Control Manual Return to Work Program section. And then if you have any questions or want to get one started or have one already, but you think it needs to be adjusted or edited or tweaked or whatever it is, just give me a call and we can sit down. You can show me what you got, and I can show you some online tools that can help you as well. So give me a call for any questions on return to work programs. Getting closer to the end here, we want to talk about record keeping and prevention. As far as record keeping goes, we talked about reporting to OSHA within that 8-hour time limit of the injury, but we also have to record it as well. And that's done through the OSHA 300 logs. And it says on here that school districts do not normally keep these 300 logs, but most, I don't want to say most, but a lot of our school districts are required to, they're asked to from the Bureau of Labor Statistics, and it could be from the Department of Labor as well. So we have quite a few of our school districts that still have to maintain the OSHA 300 logs. And if you're not familiar with the OSHA 300 logs, it's pretty much just a record of the injuries that you have in your workplace. And then we know we have to post the 300A, and that is the one that is posted from February till April, and we have a good webinar every year on January actually on OSHA record keeping. So if you're not familiar with OSHA record keeping, either give me a shout or listen to that webinar, because you should be familiar with OSHA record keeping. But as far as prevention goes, that's what I want to really hit on here, because working with Buffy and Jessica is great. You know, they're phenomenal folks, and they're a pleasure to talk with, but you know, we don't really want to talk to them too much, because that means we are having a lot of injuries. So if we can prevent these claims from happening, everyone benefits from that. So it says here, ensure that what caused the injury. So say someone got injured, let's look back at that. What happened? Why did it happen? What caused it? And let's correct that so other employees won't suffer the same type of injury or loss. If someone slipped on ice on the front steps, let's make sure that we got that ice melt right outside, or we got the cleats, the ice cleats for them. Or if it's even a kid on the playground, if the playground is in bad shape and there's protrusions and other sharp objects on the playground, and a kid gets hurt, we want to go fix that so it doesn't happen again. So that's the easiest way to prevent things, is going through our loss history and seeing what our trends are, see what our losses are, and then going back and looking at those certain areas and then fixing them up from there. Sometimes it's employee or human error, which sometimes we think is not preventable, but it is. And it's preventable through training and retraining if need be. So sometimes you think we did everything and it was just the employee was just horsing around. There's nothing we can do. Well, that's not the case. Maybe the supervision wasn't adequate for them, or maybe the punishment wasn't adequate for them the time before. Then you let it go away and you let them get away with it. So we can adjust human factors, and we can adjust how people act, whether they're horsing around or whether they're goofing off, things like that. We can make that stop, and we can make the workplace safer, which, like I said at the very beginning, the workplace is safer because of the frequency of claims for APEI members has gone way down over the last few years. So we're doing a great job of that. The last bullet point here, it says a major failure of employers is not taking action to prevent future losses caused by the same condition or processes. It says make sure to fix the problem. If an employee gets hurt, or say OSHA comes out and they say, okay, here are some unsafe conditions, you need to fix that up, and you don't fix it up, and another employee gets hurt, then they start talking about willful violations. And those are the real expensive ones when they talk about fines. So if you know what's happening out in your workplace and you're not doing nothing about it, that's on you. You got to make those adjustments and make it the workplace safer for everyone, so we can keep those workers' compensation premiums going down, which they did this last year, which is great. And obviously you can call me anytime, and I'm happy to come out and do a facility walkthrough, or if there's training that needs to be done for employees on different OSHA related activities and things like that. That's what we do. And we also have Carlene Mitchell here in the office, who is our HR trainer. So if there's HR needs that you have, that doesn't necessarily qualify for workers' comp, but if there's HR needs that you have and you're doing nothing about it, and then something happens in the future, we can look back and say, well, we could have prevented that by getting some good training out there. So prevention is huge, and that's an easy way to keep our costs down. And that's kind of the workers' compensation claims process that Jessica and I wanted to go through today. Mostly we want to familiarize you with Jessica and Buffy and who does what and how to contact them, kind of the overall process of how it goes. Like I said, we get questions all the time, or Jessica and Buffy do all the time, about what do I do here? Is this, an actual claim? What can I do to fix this? So if you have any questions, don't be afraid to contact Buffy or Jessica. It's easier to do it from the start than wait a little bit longer, and like I said, have those costs rise because we didn't ask the question or file the claim in a timely manner. Anyway, so that's what we have for you today. If you have any questions, remember at the beginning I said you should see that little control panel that has an orange arrow. If you click on that orange arrow, it'll open up a question box. If you have any questions, type them in there. If you don't want to do it right now and you'd prefer to give Jessica a call or myself a call, please go right ahead. Our numbers are right there on the screen, as well as our email addresses. And we're always available here to take questions as well. And while we're waiting on any questions, if they do come through, I wanted to let everyone know that this webinar was recorded. It'll be on our website, akpei.com. I should have it there this afternoon. You just click on the Education tab. There's a little link for training videos, and you click on that, it'll take you right to the YouTube channel for this webinar. Also, keep an eye out. We're going to be doing a new website. We should have that rolled out here in the next week or so. So keep an eye out for that. It's going to be nice and new and fresh and fancy looking, and it'll have lots of good information on there. And I don't see any questions yet. For the Premium Credit Program, if you're not familiar with that program, what it is every year we take employee training and in April, and we use that employee training to offset some of the workers' compensation premium costs. So if you attended this webinar today, you've already qualified for some training credits there. But if there's multiple people viewing from one computer, if you could just write it in the question box or send me an email so I can give everyone credit for attending. And then my last point is next month our webinar is going to be on what to expect when OSHA comes to visit. And this is one I did a couple of years ago, and I think that it can be really beneficial for a member or for an employer to know what to expect before OSHA comes knocking on your door. So that'll be for August. You should see a email or a reminder of that here next month sometime, and I recommend you attending that. Anyway, that's what we have. I want to thank you, Jessica, so much for helping us out today and kind of walking us through the process. And like I said, please don't be afraid to contact Jessica or myself with any questions in the claims process. So Jessica, thank you so much.
Yeah, thank you.
All right, everyone. Well, enjoy the rest of your day. It's getting sunny down here in Juneau, so we're going to go take a lunch break and go enjoy that sunshine. So thank you so much. Have a great day.